Okay, now we have come to what many people are most afraid of, the psychosis. Okay, what can we do when a person is psychotic? What can a psychotic person do to help himself? What can you do to help yourself if you have psychotic symptoms? Psychotic symptoms are often divided in two categories. One is hallucinations, where you hear things or see things that other people don't hear or see. The other category is called delusions. That means strange ideas that other people don't have. Often ideas that you're being followed, that you're being surveyed, or it can be ideas that you are going to be a fantastic writer one day, that you're going to marry a star, or things like that. First, about hallucinations. Hallucinations are not as uncommon as we might think. Hearing voices, which is the classical thing that people are most afraid of, that people often say is schizophrenia, means to hear voices, and voices are actually not that different from thoughts. If you ask people who hear voices what the voices say, they will often say things, you're too fat, you'll never make it. And this is exactly the same as depressed people think when they are depressed, just that they feel that they are thinking the thoughts themselves. Okay, so voices are often, in many cases, not more than thoughts that you could have had yourself, and like in obsessive compulsive disorders, thoughts can be intrusive. You don't want to have these thoughts, they just come by themselves. So you don't have to think about voices as anything more than thoughts. And you can argue against them just like you do with any negative thoughts. You can find counter-arguments, say no, I'm doing my homework, I'm doing my job, I can get better. Research shows that many people can get better, etc. That's what your voice is telling you. So both hearing voices and seeing things are much more common than what we think. Actually, around 5% of the population hears voices at any time. This was a study in Bergen that confirmed, in Bergen, Norway. That means that only 20% of these, 1% of the population, have problems with it. That means that 80% of those who hear voices actually have no problems with it. Many people will think of it as something nice, actually. People who are interested in spiritual things will often say that the voices are actually clear audience. It's things that I can hear that are messages from beyond, so to speak. Other people won't believe in this, but those who believe that it has a spiritual origin usually don't have any problems with it and can live very normal lives. Okay, later I will tell about a little technique that can take them away, if you want to take them away. With delusions, it's a little bit the same philosophy. People have believed different things at different times. In cultures different from ours, they believe things that are very strange to us. So we don't have to be so obsessed with taking away these ideas. Okay, people can have them and they can live very well with them. What is frustrating for a person who's got a very strong idea is if nobody wants to listen. If nobody believes you, then you can be very stressed about it. So rather, see what you can accept, try to accept what the person is saying, and very carefully you might argue against it with good arguments, but very carefully, very gradually. Don't say that, no, what kind of nonsense is that? For instance, a person who has religious delusions, if you are in the same religion, you might very carefully use arguments from within the religion. One patient that I had was very afraid of spirits, and in his religion they believed that God was much stronger than the spirits. So I said, but if you pray to God, if you believe in God, that He can relieve you from the spirits, don't you think it will happen? And he was very grateful. He said he had not thought about that. He just thought that he was cursed, that all these spirits were after him. He didn't think that he could ask for God's help. Okay. It's a way of, anyway, convincing the person from within his belief system. So, with delusions, also normalize, say that people believe strange things all the time. And the things we believe today are not the same things that we believed yesterday. So beliefs change, and have a relaxed attitude towards it. Okay, here's one technique that can be used for voices. Voices can be very bothersome sometimes, and especially if it is so-called imperative hallucinations. That means that people are experiencing voices that tell them to do certain things. I had one patient who had about the worst that you can get, a voice that told her to kill herself. Go and hang yourself, you swine, said a very nasty male voice in her head. She was totally devastated and said, maybe I should just do it. So I can stop this voice, maybe I should just do it. And then we devised a way that she could practice that actually got rid of the voice within a few days. I instructed her to imitate the voice in her head, saying exactly the same thing. Go and hang yourself, you swine. And then she said very suddenly, stop. No, I'm going to live. Okay, so she practiced doing this sequence. Go and hang yourself, you swine. No, I'm going to live. Then a short break, just like the visual technique. And then again, go and hang yourself, you swine. Stop. I'm going to live. Break. Go and hang yourself, you swine. No, I'm going to live. You can say stop or no in between. Actually, she did this. I instructed it for her to do this at least 50 times per day. And within 3 days, the hallucinations were gone. So this can be one way of doing it. Anyway, take control of it. Don't be afraid of these voices. They are just like very audible thoughts. Thoughts that are very easy to hear. And in many ways, we all hear our own thoughts. It's just that they don't seem as real as for people who feel that they hear voices. So, you can practice them away, and you can also know that it's quite normal to have these things for many people. And many people can live with it. You can watch a video with a woman called Eleanor Langdon, who had voices and who still has voices, but has got a much better relationship to this phenomenon in her head.